you, the member for South West Coast.
Well, how do you follow that? What is that? Just acting, just performing?
You can't follow that nonsense.
This is a serious subject, and that is just typical of what we see from across the chamber. Just performance after performance of talking the talk, pretending that they absolutely care. But the reality is, to care, you need to deliver. To deliver, you need to be able to put the runs on the board, show how you can economically provide for the community, and that's true caring. That is true caring. So, we can actually all look at the figures and we'll see the reality, because you can twist figures, and that's what's going on over there. We are getting twisted figures reported to the community, tricking the community into believing things that are not a reality. But you know what? The reality is we have a growing Victoria, and we're not seeing this government understand the needs of that community. Where are they out in the regions understanding the community there? No, they're not out in the regions, not at all. In fact, that's why our roads are crumbling. That's why we don't have access to regional rail. That is why. And if you say to me that in 4 years nothing was done, I put to you in the last 16 years, how many years have Labor been in charge and done nothing for the regions? They have no idea, once they hit the end of the tram tracks, how to even drive, let alone drive on country roads, even when they're in good nick, certainly when they're not in the poor state that they're in today. But let me get back to health. I mean, I will give credit where credit's due, and our system is a good system, and that's because of the hard-working people. Many of them hard-working nurses, doctors, orderlies, X-ray technicians, radiologists, gynecologists, specialists that give their time, devote their time to the communities, both in Melbourne and across regional Victoria. But it's tough. It's tough when you see hospitals like Portland. Portland Hospital is actually a hospital that has a very large catchment. It's a small city for the remote position that it's in. So it has a catchment of about 15,000 people, and it is the hospital with the longest journey to any tertiary centre. So you would think that might be Mildura, but they have access to Adelaide. Portland is in a real predicament, and with the current state of the funding that they receive, they are not able to meet the demands of the community. It's a growing community. It has a high youth population, and these are people who are having babies, and they want to have babies at home in Portland so that they can be in well, that's pretty obvious why you would want to do that. So you can have your family supporting you around, and your husband present at the birth. These people do not want to travel hours to the closest centre to have their babies. So it should be something that's offered in a hospital as remote as Portland. However, to keep that service going well, you have to have providers like doctors and obstetricians. So you can provide a safe service, which is all we'd expect in this day and age. But the WEES funding, when you've got a population growth, 150,000 people came to Victoria last year, Portland Hospital had an increased throughput of 9%, and yet they only got a 3.2% increase in funding from this state government. Now, you're supposed to be able to manage your own funding, but in this case of, and so what you would do, you would cut some elective services if you'd gone above your funding. But if you cut your elective services, how do you keep doctors working and enough to keep them employed? So it's a catch-22 for Portland Hospital that needs to be looked at by this government with a view to understanding the challenges they have. They need to attract doctors, but they need to be able to pay them, and they're not going to be always as busy as they would be in another hospital, and that needs to be understood. However, they can't be left with no doctor. So it's not appropriate to just say to them, bad luck, you've got a gap and you've got to figure out how to deal with it. Because what we've seen for hospitals like Portland, we've seen it at Port Fairy and Hayward as well, is we've seen increased costs from an EBA that left them with more money to pay their nurses, no problem with that. But how do they do that if they don't get the money from the government, which is giving them the money to meet their costs? So what do they have to do? They cut nurses. They have to cut services, and often that is the nursing staff if that's the increase of the EBA result, that they have to pay more for staff. So we need to understand the hospitals the size of Hayward, Port Fairy, Portland, they're getting the same regulatory demands made of them that you might see at the Royal Melbourne or the Royal Children's, but they're not getting any extra administrative support to be able to manage those extra requirements. So we've got increased costs of more staff payments, which is fine. I have no problem with the nurses getting paid well, but I do have a problem with the government saying pay your nurses more, but giving no more money in the budget to accommodate that. It just makes no sense. We've also seen electricity costs, which those hospitals specifically told us earlier this year that they could not manage the increase in costs unless the government gave them more money to pay for those power cost increases. Yet we saw none. We saw nothing in response to that the government would actually say, right, we understand your costs have gone up and we need to allocate money accordingly. No, we see services cut. That is the only option for these hospitals, and so regional Victorians are at a disadvantage when their health needs are unable to be met. What I see too is a 30% increase in the public sector spend. So that concerns me when I hear from nurses that instead of the hospital being able to meet their pay rise through government extra funding, they're actually seeing their colleagues not being able to be employed and losing services. So 30% increase, I would hope to see better outcomes from more people in the public sector. So I would have thought I'd see more nurses, but that's not what I'm seeing. I would have thought I'd see more teachers and better teaching outcomes, but that's not what I'm saying. I would have thought I'd see a safer Victoria from more police, but I'm not seeing that either. So I don't understand why we're getting increased public sector costs, but not increased outputs from that. It just doesn't add up any more than not funding a hospital to accommodate the growth that the government has orchestrated through increased power costs or increased staffing costs. The other thing I wanted to bring to the government's attention was the fact that they can sit there saying, oh, we don't get enough funding. Well, here you have a community in Warrnambool with a proven track record that has a hospital that needs to have the nerve centres funded. Now, all we've seen this government do in the last budget was set up a consultative group. That's great. Well, guess what? We know what we need. We need an accident and emergency. It is not big enough to meet the needs of a major MCA that may occur and does occur in our region, where you need a lot of staff in the accident and emergency at the critical time. It also doesn't have enough theatres. We had an incident recently that me, knowing a lot of the health staff in the region, heard about where a baby was at risk because the theatres were full, and to get the caesarean section in time was a close call. Now, we've got increased people in the community demand-wise, population-wise, so we obviously need more than 3 theatres that I worked in 32 years ago now when I started my training and did my theatre time in 3 theatres, the same 3 theatres there today. So get on with it if you really care. You know we need it, just build it. The last thing I want to talk about is the Lookout, which is demonstrating how committed my community is to helping themselves. Here you've got a community who says, we know there's a drug and alcohol problem. It's a health problem. It's a health problem. It ends up being a criminal issue, but often, and it ends up being a family violence issue often, but it starts off as a health issue. So the community said, let's build our own centre, a rehabilitation centre where those who want to be rehabilitated can actually stay for 3 months and be supported. So they got together, they've raised I think it's over 600,000. They've got another 600,000 committed. They need 1.1 million of recurrent funding committed from this state government, and they will get it done. They will get that area addressed. And what have we heard? Nothing. It's an opportunity where the community have said, we'll do our bit. We only need a little bit of recurrent funding. We've got everything sorted otherwise. What an opportunity. And you've seen Warrnambool do it before. You saw the cancer centre. The cancer centre that everybody said Warrnambool wouldn't get. But the Liberal government both federally and state in the Napthine time saw that come to fruition. And that was because the community decided that it was needed and the Libs backed them. So don't tell me that health is not something that Liberals absolutely treasure. We are not anywhere near unaware of the fact that it is a high priority of our community. It's a high priority of mine, it's a high priority of my colleagues, and it's because we understand health, education, all those real basics are what we must do with absolute commitment to, and we do. We do it fiscally responsibly, and that's how you make care really work.